About 80 million people here in the U.S. experience hair thinning or baldness. Triple board certified Dr. Richard Chafu is here now with options to give you those luscious locks. Once again, Doctor, good morning. Thanks for being here.
Good to be here.
Okay, let's talk about the main causes for hair loss in men. We've talked about this a lot through the years. What is it?
Of course, the main cause is what's called androgenetic alopecia, or AGA for short. And it's actually hormonal, it's hereditary, and it's thought to be progressive. So about 40% of men, by the time they're 40, begin to lose their hair, and that number goes up per decade.
Wow.
So it's a common, and the interesting thing, Raul, is you have to lose about half your hair in an area before you notice clinical baldness. So you've lost a significant amount of hair by the time you see that in the mirror.
Okay, some of the hair loss factors. You mentioned heredity.
Hereditary.
Is it true that, because I grew up and my grandfather was bald as can be from an early age, and they said, well, you go by your grandfather, it skips a generation and things like that.
Variable.
Is that accurate?
It's not entirely accurate, Raul. You're right, there can be a hereditary component, but it doesn't necessarily have to be on the mom's side. It could be on the mom and the dad's side. In some of those cases, you actually see worsening baldness if it's on both sides of the family.
Okay, other factors. You mentioned hormonal changes, medical conditions.
There are some medical conditions that you can experience. A chronic illness, stress, certain medications that you would take. Obvious things like thyroid disease and the other systemic illness. Radiation therapy can be a causative factor. Trauma. Certain hairstyles, interestingly enough, can certainly in women. If women are braiding their hair in a very tight manner, you can get something called traction alopecia. People that use very strong, stringent chemicals to dye their hair frequently can damage the hairs.
This I found interesting. A very stressful event can cause your hair to fall out?
It can. It's called shock loss, or the medical term is telogen effluvium. So, we see this in women after they've delivered early on, postpartum hair loss. It's temporary. But you're right. If someone has gone on a very crash diet to significantly lose weight, a stressful event in their life, you can temporarily shed the hair, but it's a temporary phenomenon. Usually in several months it will return once that stressful event's gone up.
It's amazing how the human body handles different things in different scenarios. What symptoms should men be looking for? I know a lot of guys in their 20s are already starting to do this or that.
You're right. It can start at a very young age. And what you'll notice typically in men is you'll begin to see the hairline as we get older begins to not only go up, but also we begin to get these deeper recessions in the temporal areas. And again, you just begin to start seeing your scalp through your hair. By that time, you've lost probably about half the hair in that region.
If it's hereditary, is there something you can do to prevent it? Is there a way to prevent it altogether, or you just kind of push it back and delay the inevitable?
So there are some very effective medications that can be used by your doctor. The FDA has proved something called finasteride, which is a pill. About 85% of men that are on that will stop losing their hair, and about 65% of those subjects will regain their hair. So there are some very effective medical treatments that can help to maintain the hair, but you're right, it doesn't affect everybody. Certainly you may continue to lose your hair.
What about women?
So in women, the same thing. There are medications. Hair loss in women too. There is hair loss in women. Rogaine is a good medication, but many dermatologists are actually using something called spironolactone, which is actually a diuretic, not a very good diuretic, but also blocks hormones, and it can be used. And actually in postmenopausal women, many dermatologists use finasteride because it can be used in the same manner to reduce hair loss.
We have some pictures, because a lot of people think, well, what about me? Which kind of balding do I have? We have some different types of balding.
Right, so this is somebody with a more progressive loss, somebody in their 60s, and this is a procedure where we're not using the old strip technique you've heard about, taking hair out through a large scar. We're using a small follicle, a small punch to remove it, doesn't leave a scar, and actually retransplanting the hair the natural way it would grow. And a lot of people are worried it's going to look unnatural. We've all seen that pluggy type look. Today we don't see that. We see hair being transplanted and grows in the same way it would normally grow in your scalp.
The same pattern, so that it looks natural. This is also interesting. You don't think about the beard.
Right. So a lot of men don't have an ability to form their beard very effectively, and we can actually transplant individual hairs into like the mustache, the beard pattern, sideburns, and even in women, the eyebrows, we can go in and transplant in those areas, make us look very natural.
Are there drawbacks to that for people who may be a little scared off by it?
Sure. So the first thing, obviously, obviously is you want to find someone that has a lot of experience with this. Again, like we said, medical therapy may work, but you want something with this newer technology, what's called FUE, or follicular unit extraction.
Okay, and this is important too, because there's you have a new book on Amazon now about this
Exactly.
subject.
You know, my wife and I, she's a dermatologist, we wrote a book because there hasn't been anything good out there for about a decade written by doctors. First book written by both the derm and plastics about hair loss, the medical treatments, the surgery, the options available. It's under 100 pages, and all the proceeds go to something called Advantage Autism. My daughters and wife actually started a nonprofit for tennis program to teach kids with high-functioning autism social skills. So all the proceeds will go to that. But it's a helpful short read for people with hair loss.
Excellent, Doctor. Look at you two, like a power couple over here. I love it. Dr. Chaffout, we thank you as always
Thanks,
for the
Raul.
expertise.
Good to see you.
Good to have you.